In last class, we were discussing about the anatomy of uterus to continue with the uterine prolapse. So from the anatomy, we been aware that I hope you all gone through the anatomy portion once again, and it might be clear to you all. The structure called uterus, which is for the regeneration of another life, an organ specially meant or organized or formed by the nature for the development of another life. So it must be protected and held well. So it is a structure with a thick musculature to give support and protection to the intrauterine life, and it is later on covered by the pelvic bone, and the structure is placed at place with the help of ligaments and is supported by various muscles. So and along with that, flexibility is also there, because at term this structure have to expand, give that uterine cavity is enlarged to give space to that developing fetus. And at the time of parturition, or you can say delivery time, these muscles only contracts. This thick musculature helps to expel out that organ, and the ligaments that are stretched and contracted various time to give support, and then at the time of delivery and in the postpartum period, it gradually comes to the position. So various changes occurs in this structure and the support system, and that is the reason why it is prone to the prolapse, and especially in the case of multiparous females. And along with that, the age factor, because hormones which give support to that organ diminishes. So once again, that support system is become weak, and the chances of prolapse are more. So we will discuss with the prolapse in short in the slides. We started in the last class, and it's a kind of gist of prolapse, you can say. So what is prolapse? Uterine prolapse is downward displacement of the uterus into the vaginal canal, or gradually descents of the uterus in the axis of vagina, taking the vaginal wall with it. So we discussed about the how the uterus is placed in the cavity, what are the angle of flexion, antiversion, antiflexion, and all that. So here it and the axis where it is standing, it comes out and or descends out from the cavity, and it's gradual. ऐसा नहीं कि एक ही बार में पूरा प्रोलैप्स हो जाता है, ये ग्रेजुअल प्रोसेस होता है. So here the uterus is placed, urinary bladder, rectum, and this is the normal position of the uterus, and angles normal antivert antiflexion, and here it descends down of the cavity. It's kind of herniation only, but in other herniation, that organ is placed and inside the body only. But here it is as it is open, there is open space, so it comes out from this open space and it's visible. So it's called as prolapse. Usually prolapse is rated by degrees. First degree prolapse, the cervix rests in the lower part of the vagina. This is the first degree. ये cervix जो है वो वजाइना के लोअर पार्ट में रहता है, मतलब वो हमेशा बाहर विजिबल नहीं रहता है. इन सेकंड डिग्री प्रोलैप्स, cervix is at the vaginal opening, it is just at the vaginal opening, so it is easy to see the cervix. And in third degree prolapse, the uterus protrudes to the introitus, तो यहाँ पे यूट्रस का काफी पोर्शन बाहर आ जाता है. So if cervix is in the lower part of vagina, that means it is not coming out. Patient may complain of feeling something that is obstruction of urine, or some obstructions are there, or a feeling of something coming out. In second degree prolapse, she can feel, and in third degree it is clearly visible. So here is the first degree prolapse. Cervix is within the vaginal cavity. In second degree prolapse, the lower part is here. With the help of instrument, we can see very easily. And in third degree prolapse, it's always outside. With the support, we can push it back many of times. And due to this, the regular process of defecation, micturition is also hindered, and source of infection is also increased. So special precaution and care is to be taken. And when we go to the etiology, we discussed stretching of muscles and fibrous tissue. For example, during pregnancy and childbirth, increased intra-abdominal pressure as a result of chronic coughing, lifting of heavy objects, obesity, place pressure on pelvic floor. So, like other herniation, these are the intra-abdominal pressure may result in prolapse. And a constitutional predisposition to stretching of ligaments as a response of presumably to ears and the erect position. तो ये कॉन्स्टिट्यूशन ही उसका ऐसा है कि वो लिगामेंट्स में स्ट्रेचिंग होती है, जैसा कि हमने क्लास की शुरुआत में ही डिस्कस किया। तो वो इरेक्ट पोजीशन पे है, तो एक उसका फॉर्मेशन, प्लेसमेंट, ये सब चीजें कहीं ना कहीं कंट्रीब्यूट करती हैं इन द लेटर लाइफ. And menopause and aging increase the risk of prolapse. The female hormone estrogen plays an important role in maintaining the strength of the pelvic floor. So at the time of menopause, these hormones decreased, and the strength system become weaker, and due to weakening, it may result in prolapse. So at the sacrum, and this is the uterus and pelvic walls. So uterosacral ligaments gives support posteriorly, and cardinal ligaments lateral supports, and below pelvic floor is there. So the uterosacral ligament becomes weak, stretched uterosacral ligaments and stretched cardinal ligaments. तो जितनी इसमें स्ट्रेचिंग और वीकनिंग होगी उतना ही डिग्री इसकी प्रोलैप्स की रेस होती जाएगी. एंड ये pelvic फ्लोर की भी स्ट्रेचिंग हो जाती है और इसमें गैप्स आ जाती हैं. So these are the main etiology and the structural changes in the normal anatomical position of the uterus during the prolapse, and how the patient comes to you with the clinical manifestations like feeling like you are sitting on a small ball. Patient feels like that discomfort in sitting also, and difficult or painful sexual intercourse as the cervix is displaced or descended down. So the coitus is also painful, frequent urination or sudden urge to empty the bladder. Why this is so? Because of the pressure given by the cervix to the uterus. And low backache, because the ligaments are disturbed, sacrum and uterosacral ligaments are stretching, and due to that stretching, uterus is coming down. And if some gap-like structure is formed in or cavity-like structure is formed at that place, so it gives low backache. Uterus and cervix that stick out through the vaginal opening, showing off the uterus or cervix through the vaginal opening. She can feel or see that. And frequent bladder infections, as the part which has to be inside, it is coming out, it is more prone to infections. And due to that also, that retention of urine is also, bladder is not being empty. So repeated bladder infections, feeling of heaviness or pulling in the pelvis. That heaviness felt in the pelvic area, and vaginal bleeding. It is not always, but due to the distortion, as the cervix is meant to be inside the body, and when it is outside or in the vaginal canal, due to the rubbing process in sitting or any activity, or in as you can say, so vaginal bleeding is also seen sometimes, and increased vaginal discharge. And the most common cause of increased vaginal discharge is infection or the due to pressure effects, retrograde effects. And what is the treatment? Vaginal pessary. So it is basically designed to fit that descendant part inside the vagina. This device fits inside the vagina and holds the uterus in the place. These are the ring-like structures most commonly used, or discoid shape. In various shape pessaries are there, and these ring pessaries are commonly used. It is used as a temporary and sometimes as a permanent treatment also. Vaginal pessaries come in many shapes and size. So, so what's the role of pessary? That with all the safety precautions, with the sterile setup and sterile gloves and all the sterile instruments, with the help of ulceum, uh, that cervix is viewed if it is first or second degree, and basically it is used in second or in the old females where the surgery is not possible in third degree even. So just view the cervix, press it back gently, and with the help of pessary, place the uterus on the position. You can see here also these pessaries. This is ring pessary. It is used to keep the uterus in the position. In normal condition, these ligaments and muscle and pelvic floor, all that helps the uterus to be in position. But in later stage of life, due to multiple pregnancy or hormonal decrease or any other pressure or any of the reason, when this support system fails, we have to use external rings or pessary like structure to keep the uterus in place. The surgery, several different types of surgery can be used to treat severe genital prolapse, like surgery to repair the tissues that supports the prolapsed organ. If there is uh, tissue damage, then tissue repair to support that prolapse, and surgery to repair the tissue around the vagina, surgery to close the opening of vagina. In the case of when there is no need of uh, uh, any deliveries or female is postmenopausal, in some of the cases, they just close the opening of vagina to inhibit the descent, and surgery to remove the womb, that is hysterectomy in severe cases. So collaborative, yes. In collaborative care, preventive measure, first we have to explain the early pregnancy. All these methods, I think you have gone through the lectures of Garbh Sanskar also. These things are meant only uh, for the health of the female. From the early stage pelvic floor exercises, when the ligaments are stretching, that don't have to give extra pressure. Please mute yourself, Paras Dikshit. Please mute yourself. Class is being disturbed. So at the time of uh, pregnancy only, the routine which we have to follow, or the some of the exercises, or you can say asan, are being taught to the female, just that support or improve the condition at that time also. It is for the future also. Pelvic floor exercises like Bhadrasan and all that to make the pelvic floor strong. Some of the asanas also, or the counseling at the time of delivery, you don't have to give extra efforts, and all these activities that are being taught at that time, that helps the smooth delivery or the smooth changes, or to postpartum care also. If she's under your guidance, then it's okay. Otherwise, you can explain her earlier, or even that at postpartum time also you have to take proper care, so that your body is being fit at the time or of the pregnancy or delivery or postpartum period, and even after the your postmenopausal phase or later stage of life also. So preventive measures, early visits to healthcare provider for the early detection, Kegels exercise. Kegels exercise during postpartum period. That only I am saying. The early stage we have to prepare the female. मतलब कुछ तो डराना नहीं है कि आप ऐसा नहीं करोगे तो प्रोलैप्स हो जाएगा, नहीं, बट ये चीजें आपको करनी है. कि उनको कॉन्सिक्वेंसेस बता के डराना नहीं है, बट हाँ, उनको अवेयरनेस होनी है। प्री ऑपरेटिव नर्सिंग केयर, thorough explanation of procedure, expectation and effects on future sexual life, and laxative and cleansing edema. Many times due to constipation also they give extra pressure, rectocele, and independent at home or day prior procedure. Perineal shape is also prescribed. Lithotomy position for surgery is for the surgical procedure. And post-op nursing care. Patient is to wait few hours of surgery. Catheter is unable. Uh, um, these are for the surgical procedure. So in short, it is just the introduction of the, in short, it was just the introduction, or you can say the gist of um, uterine prolapse. So is there any doubt, any confusions, the prolapse of uterus, or regarding the anatomy? So it's a not a vast topic, but it is an important topic, and कि ये एक कॉन्सिक्वेंसेस क्या तक हो सकती है इन नॉर्मली नॉर्मल चीजें। मेनोपॉज रोक नहीं सकते, डिलीवरीज होनी है, प्रेगनेंसी होनी है, तो ये सारे प्रोसेस एक फीमेल की लाइफ साइकिल में होने ही हैं। और इसके ये कॉन्सिक्वेंस में ये भी होने की चांसेस बहुत ज्यादा हो सकती है, बट ये होना ही है ऐसा नहीं है। इसको हम शुरू से ही केयर करें तो इसको स्टॉप नहीं तो इसके रेट को डिक्रीज बिल्कुल कर सकते हैं। और प्रॉपर अवेयरनेस, प्रॉपर काउंसलिंग, गाइडेंस, ये सब होना जरूरी है। एंड वी पीपल आर ओनली रिस्पॉन्सिबल टू डिक्रीज द रेट ऑफ प्रोलैप्स। So just take your responsibilities and just guide the females around you or the females under your counseling. So is there any doubt or any questions? Then you may ask.